Infection Control Series 6. When you look at this picture, it highlights the reality that it is not always possible to tell what diseases a person may have from looking at them. For this reason and others, routine practices must be applied to everyone. Body fluids are exposed during oral care. For example, saliva, respiratory particles, things like this. So it is important that routine practices are practiced with every resident, even more so when doing oral care. Pathogens are unseen to the naked eye. Residents may be unaware that they have an infectious disease or cannot communicate it if they do know. There are 5 main routes of transmission. Today, we will briefly discuss 3. Number 1, contact transmission, which is the most important and frequent mode of transmission for healthcare-associated infections. And it's divided into direct and indirect contact. Direct contact transmission involves a direct body surface to body surface contact and physical transfer of microorganisms between an infected or colonized person, such as what can occur when a healthcare provider provides oral care. Indirect contact transmission involves contact between a susceptible host and usually a contaminated inanimate object, such as a denture brush. The second area is droplet transmission. Droplets are generated from the source person primarily during coughing, sneezing, talking, and during the performance of certain procedures, such as can happen during oral care. And the third way is airborne transmission. Airborne transmission occurs by dissemination of either airborne droplet nuclei, small particle residue, of evaporated droplets containing microorganisms or dust particles containing the infectious agent. Routine practices is the system of infection prevention and control practices that is used during all care with all patients, residents, or clients to prevent and control the transmission of microorganisms in a healthcare setting. To achieve proper infection control, there are certain practices that are in place. Routine practices and additional precautions replace the older term of universal precautions. Universal precautions referred mainly to blood-borne pathogens, but routine practices and additional precautions includes pathogens found not only in blood, but in any body fluids, secretions, mucous membranes, and non-intact skin. Additional precautions are necessary in addition to routine practices for certain pathogens. These precautions are based on the method of transmission, for example, contact, droplet, airborne, or a combination of these, such as droplet contact precautions. A risk assessment should be done with every resident. A risk assessment is an evaluation of the interaction of the healthcare provider and the client, patient, or resident, and the client, patient, or resident's environment to assess and analyze the potential for exposure to infectious disease and identify strategies that will decrease exposure and prevent the transmission of microorganisms. Some people cannot communicate with the oral care provider so that the risk assessment can be done. This is why everyone is always assumed to be infectious. Therefore, we always use routine practices. It doesn't matter if a person can communicate or not. Routine practices is always used. What constitutes as routine practices when doing oral care? First and foremost is proper hand hygiene. Hand hygiene is the single most important procedure in preventing the spread of infection. You'll notice listed in this slide are the 4 moments for hand hygiene in a healthcare setting. Before initial patient environment contact, before aseptic procedure, after body fluid exposure risk, and after patient or patient environment contact. Hands should also be cleaned before touching a resident or anything in the resident's environment. So, for example, their oral hygiene tools. This act protects you as the caregiver and the resident and their environment from germs on your own hands. When using gloves while providing oral care, it is important not to touch sinks and taps or bed rails with gloved hands. So when doing oral care, prepare all the tools that you will require in advance. Place them close to you so that you will not need to touch other items in a resident's room unnecessarily. And this will minimize the transfer of microorganisms. Hand hygiene can be done by washing your hands with soap and water for at least 15 seconds, or by using alcohol-based hand rub applied for at least 15 seconds to cover your hands. If the hands are not visibly soiled, then an alcohol-based hand rub is the preferred method for decontaminating your hands. If they are visibly soiled, washing with soap and running water must be done. This should be done before and after oral care is complete with each and every individual and in between residents. If your hands are exposed to bodily fluids such as saliva, wash your hands immediately after exposure. Wearing gloves, while important, is not a substitute for hand hygiene. Rather, it should be used as an adjunct to hand hygiene. If there is a risk of the healthcare worker's hands being in contact with blood or bodily fluids such as saliva or non-intact skin, mucous membranes, then gloves should be worn. Hands should be cleaned before and after gloving. Gloves provide an additional protective barrier between the healthcare worker's hands and the resident's secretions, thus reducing the transfer of microorganisms between the patient and the healthcare worker. Gloves should be disposed of in the garbage. A mask and eye protection should be worn by a healthcare provider to protect the mucous membrane of the nose, mouth, and eyes when it is anticipated that oral care activity is likely to generate splashes or sprays of blood, body fluids, secretions, or excretions, or within 2 meters of a coughing client, patient, or resident. It is up to each individual to make a decision based on individual risk assessment as to what personal protective equipment staff is required to wear when performing oral care. Bacteria and viruses may survive for weeks or months on dry surfaces in the environment of the resident and may also be touched by the healthcare provider when providing care. Therefore, it is important to clean and disinfect surfaces once the oral care is complete. Cleaning and disinfecting products must be approved by Environmental Services, Infection Prevention and Control, and Occupational Health and Safety, have a drug identification number from Health Canada, be compatible with items and equipment to be cleaned and disinfected, and can be used according to the manufacturer's recommendations. Disinfectants chosen for healthcare should be active against the usual microorganisms encountered in the healthcare setting, ideally require little to no mixing or diluting, be active at room temperature with a short contact time, have low irritancy and allergenic characteristics, and be safe for the environment. Always remember, clean and disinfect surfaces that have been contaminated during oral care when you are finished. These are some tools used for oral care. There are certain times in which an oral care item should be discarded for the purpose of infection prevention. For example, if any oral care item that is going in the mouth, so for example a toothbrush, or that will directly come in contact with something that will go in the mouth, for example, a denture brush will come in direct contact with the dentures that will go in the mouth. If any of these things should fall on the floor, it should be discarded. Another example is after a resident recovers from an illness such as a cold or a flu, these oral care items should be discarded. So the toothbrush, the denture cup, or the denture brush, these should all be discarded. Denture cups can also harbor bacteria and fungus if they are not cleaned well and regularly. Therefore, when cleaning denture cups, care should be taken to thoroughly clean the box. Every day, the box should be emptied of the solution that the denture was soaking in overnight, rinsed, and be dried thoroughly. Often missed when cleaning are the ridges on the lid. These should be cleaned and dried well. Dishwashers can also be used to clean denture cups. Denture cups can be viewed as any other utensil. As long as the dishwasher has met the approved food safety regulations by having a sanitizing cycle, this is adequate for cleaning the denture cups. It must have a wash and rinse cycle and be able to sanitize through the use of hot water or chemicals in the final rinse. It is important also that the oral care items be labeled so that there is no transferring of toothbrushes from one resident to another in the event that the room is shared. Cloths are used for oral care to cleanse the mouth of debris and liquid and to drape across the resident's chest. Ideally, for use in the mouth, a disposable cloth is preferred. However, some homes or facilities prefer to use a cloth that is not disposable. If a non-disposable cloth, such as a towel, is used for oral care, it should be placed in the appropriate bin to be washed once the oral care is complete. Regarding infection control, it is good to consider where the oral care items should be stored. If the toothbrush or denture brush are being stored in a container that allows it to dry, they should be placed with the head up, as seen in this picture. It should not be placed in a sealed bag. They should not be stored with any other items, such as a hairbrush or a comb. This container should not be stored near a toilet, as the aerosols created when flushing the toilet may land on the toothbrush. A wet brush is a perfect breeding ground for bacteria. As a suggestion, it may be best to store the oral care items in a cupboard in the bathroom if it is available. If it isn't being stored in the cupboard, it should not be touching anything else. If an electric toothbrush is being used, it should be rinsed thoroughly and allowed to dry. If a bathroom is shared by more than one resident, it is important to store each resident's oral care items separately. Again, this is another reason why it is important to have each oral care item for each individual labeled. Always remember that routine practices applies when doing oral care. Bacteria, fungi, and viruses can and do live in the mouth. It is important to practice proper hand hygiene and While wearing gloves is not a substitute for hand hygiene, they should be worn while doing oral care in addition to hand hygiene. Oral care items should not be stored with other personal care items such as combs, brushes, and medication, and they should not be stored with anyone else's brush, and they should be allowed to dry, and they should also be labeled. For more information and more references on infection control standards, please see these additional resources. Thank you.